Labdien vēlreiz visiem!
Hello everyone, my name is Uģis Joksts. I'm a journalist of Latvian television. I'm from Cēsis. And when coming here to Rutska Park, I studied not far from here. My school is over there. And I remember the connection between today's topic and in Rutska manner, I worked as a medical cleaner assistant, and now it's being renewed. This was a facility for treating tuberculosis. I have a topic today I'm afraid of. I'm afraid to look into the past and the present and future of medicine. Can we forecast diseases as weather conditions in the future? How many, yes, how many are saying that we will be able to look into our application and know how we are going to feel tomorrow? How many knows? I don't know whether you are skeptics or optimists. But you are more than those who are saying yes. But I have three professionals joining me with your help. They are going to try and picture a forecast of what's going to happen. Now, scientist of Biomedical Research Service Center of Latvia, Aija Linē, un Rieksniņa professor of the medical faculty and the doctor of medical science, Kaspars Stepanovs, as well as co-founder of My Emerge and My Veselības dati platform co-founder Gundars Razevskis, colleagues. Let us imagine a situation. It is 2030, like 10 years from now. Let's remember what we did 10 years ago and today and in 10 years. Let us describe how diagnostics are going to take place in 10 years. Who is going to start? Hello, I'm going to start. Let's start from my side. So in a couple of sentences, your vision. I will have a laptop, and it will give me signals. Now you have a certain age, you have to go through certain checks, and the previous checks also remind you that you have to visit certain specialists. Aija, how about you? I think we have to distinguish two things. First-time diagnostics, if we are going to forecast what is going to happen. Speaking about forecast, I would avoid coming up with certain forecasts. But if we are speaking about first-time diagnostics, I see the following. It will take place at the doctors, but there will be many devices, easy-to-use devices. For example, by blowing in or blowing at, or by dropping a drop of blood, it will be easier without any invasive, unpleasant, and complicated activities. It will be easy to diagnose everything. Kaspars, looking at how things are developing, I believe that in 10 years people will already know about or have suspicious about their health. Only then they will go to the doctors, and they will inform the doctor that they have certain traces, certain changes in their health, or from genetic tests they will be able to distinguish what's going most probably to happen to them, and specialists will lead them. And Gundars, I agree to everyone who already spoke, but I would like to say the following. We will visit doctors less. We are going to use devices as we are now used to doing. We will use applications, devices, programs at home. I understand that in-depth diagnostics will take place at the doctors, but speaking about monitoring one's blood pressure, on blood pressure devices are already installed in one's watch, in one's mobile phone. So big companies who are producing medical devices are incorporated in our daily applications, in our daily devices. Already now you can measure your blood pressure or your pulse or your pace. I believe in 10 years, all medical devices, certified medical devices, will be incorporated in our mobile devices. And 80%, you will be able, by 80%, you will be able to diagnose yourself from home. Do you want to share your imagination, what's our future is going to look at? You have to talk into our catch box. I believe that also in 10 years, no one will substitute functional patients. We will not deal away with them, and we will have to search them because they will feel bad. They have suspicious about their health because of certain indicators. I think the number of patients is not going to go down in 10 years. You are a doctor. You don't want to have less patients. I would be happy if I had less patients, but by seeing the number of patients now, I can't imagine that there will be less patients. Patients will become more informed, and they will be even more informed. They will want to be reassured about being healthy, or indeed on the contrary. Anyone else want to share? Okay, we warmed up a little bit. Now I would like to return back to the reality. What has happened some years ago? Ladies, let's talk about your research about cells. Cells, how you diagnosed, how your technology worked. Thanks to Norway grants. This research was meant at researching cells, the content of cells, and how they can be used for diagnosing prostate cancer. But before I go into depth, I would like to tell you how we diagnose prostate cancer now. It is unique because we can do the blood test, how we can really diagnose prostate cancer. No other type of cancer can be diagnosed by one's blood test. And this test is PSA or PSA test. It is being used for more than 30 years in the world. And now we can understand the benefits of this test and also what is the price of it. What's the benefit? With the help of this test, we can diagnose prostate cancer in an early stage. And there's a number of people, of men, whose life was saved due to this test. But there is another contraindication, or over-diagnosis and over-treatment, meaning that clinically insignificant cases are being discovered for people who could have lived their life peacefully without even knowing that they have cancer, without being treated. One of the proofs that prove the existence of that are autopsies. After those autopsies, we discovered that prostate cancer in several populations they differ, like in 35 to 50% of men aged 70 to 79 have cells of prostate cancer. They have lived their life without knowing that they do have this diagnosis. With the PSA test, more and more cases are being discovered. And at that moment, the damage is already done. The person is being diagnosed, and it is not faulty diagnosis. And the person goes through all the treatment and all the diagnostics phases. And where is the problem? What's the problem that occurred? This is being done, and it has changed the focus. The focus of scientists. Like if some years ago the main topic was how to elaborate new methods, how one can discover cancer as quickly as possible. Now we understand that this is not our main goal. We have, first of all, to discover clinically significant, potentially lethal cases of cancer. And this is the main problem. This is not only for prostate cancer, but for all types of cancer. And this is important to identify grave or severe cancers, and we have to look for a new approach. We have to look for something absolutely new, so we can come up with targeted diagnosis. Is that what you're saying? The main aim is not to discover all cases, but clinically important, potentially lethal cases. Those who live up to the age of 80 and die of something else, those we let alone. Those shouldn't be traumatized. Those shouldn't even be tested. But we don't know which ones are our potential target group. In our research, we research vesicula that our cells contain. Those vesicula are floating around our organs in all our cells. And here you can see also the picture, how it looks like in microscope. So those vesicular bubbles are floating in our blood cells, and protein DSN fragments are floating in there, coming from cell that is producing vesicula. And if former, we thought that this is the way how the cell is relieved or releases waste. Mainly it is the signal. Now we know how cells communicate between each other. If one cell produces vesicula, it floats into the bloodstream and goes to another place, and another cell somewhere else accepts this vesicula, and with the help of that receives certain signals. The idea for our study was the following. If we could tell by the vesicula of a cancer patient and study the molecular content and expect that vesicula is coming from cancer stems, and by analyzing molecular content, we could establish the existence or the absence of cancer. Also, we can study the molecular content of a cancer type, as well as whether it is aggressive or not. In this study, we researched DNA content in vesicula. We tried to find molecular that are significant of prostate cancer, as well as functionality of these vesicula. in which stems, in which cells they are being accepted, and what effect they have on immune cells as well as other cancer cells and in cells in general. I think I have spoken a lot. We have to understand what this story. I was a partner of AIA in this project, also in another similar project that we studied. So those what those vesicular do to immune system, and mainly we stated that immune cells could work as suppressive cells, somehow diminishing the cancer, not by oppressing immune cells, but the contrary. Now, this is a simplified explanation. And we reconfirm that, yes, this information that cancer is sending out sends that the message that cancer wants to survive in one's organism. Also, our studies show that those vesicula produced by cancer cells are stimulating progression of cancer, the growth of cancer. With the help of vesicula, cancer cells communicate between themselves, and if those cancer cells that have been in bad circumstances, in not so beneficial circumstances, for example, lack of oxygen, they survive through vesicula. They inform other cells and prepare other cells for those unbeneficial circumstances. And what one cell learned, other cells is being informed of, namely of those less favorable circumstances. Basically, through vesiculas, cells communicate, and as I already said, with the help of vesicula, immune system is being suppressed. Immunosuppressive environment is being created. Immune cells cannot suppress and fight cancer cells, as well as they prepare environment for cancer cells. When cancer cells travel to another place in one's organism, they have already very good grounds prepared for them, for their growth. Thank you very much, the taxpayers of Norway. But now the story, how it ends, about your conclusions, whether we can apply your conclusions in real life. Can we target the investigation, the diagnosis of people, also the population of people that has to be tested? One more thing that I wanted to mention, practical functionality of our study. The second thing is whether by the content of vesicula we can diagnose cancer and severity of cancer. Our conclusion is the following. If we can discover RNS molecule, then we can establish the existence of cancer. But whether it is clinically proven, not at the moment. But why? Mainly because the mixture of vesicula from all organs is very complicated in our organisms. And it seems that proportionate content of cancer cells is relatively little. And there is a group of patients where we cannot discover RNS molecule that could signify the presence of cancer cells. So we understand that we cannot analyze the whole mixture of all vesicula, but we are now looking for specific markers that can be eliminated from the blood tests, namely where we can discover only the existence or presence of cancer cells. So your study is on its way to prove that it will be possible to diagnose. Most probably is the answer, but it's a long way to go. Okay, let's fantasize, taking into account the title of our discussion, how it's going to look like when you will finish your study. Do fly in your imagination. So the thought was the following. Let us first of all take the material for tests, for example, urine test, which will be in a non-painful way, and thus we could submit it for DNA analysis, DNA test, and then we can analyze it and come up with a real test. Okay, what is your vision? What we are working on, for example, a microscopic test tube where we can place a drop of blood or urine, and with the help of this little device, we see a picture or an image that can be photographed with a mobile device. And this device works as pregnancy tests, for example. And with the help of this little device, we can establish whether, in this example, in this sample, we can discover cancer cells. Whether the patient has or doesn't have cancer. It's easier than forecast weather conditions. One can do it at home. One device is needed. We photograph it with our mobile phone without leaving one's home. We send it to a doctor, and everything is clear. But you have to distinguish one thing, whether we talk about a patient with a known diagnose, which is in need of monitoring and in need of a better and more convenient way to live with one's disease. And there, I agree with mobile application. But if we talk about first-timers, first-time test, first-time patients with doubts, he has a choice whether to go to the doctors or he will take a device and does the test. So you are more saying that for the first time, it has to be established by a doctor. The presence of a cancer has to be established by a doctor, and only then you can monitor yourself with the help of device. Kaspars, what do you think about it? In 10 years, if a patient discovers at home that he has cancer, meaning that there has to be a surgery, which might mean impotency. It's not what is happening. The surgeries are not being done without in-depth tests, histological analysis. No surgeon will perform a surgery based on a drop of blood in a device. This is just a mechanism that might help the doctors to combine it with other methods, be it a prostate cancer, which can be diagnosed with MR. You can actually look at the pictures, at images, whether whether this organ, prostate, is enlarged, also the severity of the cancer, whether it's aggressive or not. In a less aggressive case, the person might live with his cancer the rest of the life. And if there is a presence of biomarkers and the cancer is more severe, then it has to be surgically removed. But one also can see at which place the needle has to be placed in to come up with the most certain diagnosis, the best outcome of a test. This will be just an integrated solution, like an addition to other methods that will be used. It's not just everyone is going to be placed on a surgeon's table after a drop of blood. So yes, I understand that this is just a help for patients and doctors. Kaspars, do tell us, how is it in Latvia about diagnosing certain diseases? Speaking about prostate cancer, it's being done with the PSA test, which is by no means precise. And if there are deviations from the norm, additional tests are being performed, either by biopsy from certain places of prostate. They are being analyzed. And for patients with exceeded PSA, one cannot sometimes diagnose presence of cancer because the test is being taken from a place where cancer is not prominent. That's why the test is being repeated, and sometimes MR is also necessary, or sometimes fusion biopsy when MR and biopsy images are being placed over each other to come up with a more precise diagnosis. And if it is being complemented by last generation biomarkers, then it is much better. So you are saying by 20%? No. 20 years ago, we already had possibilities for MR, but like 10 or 20 years ago, it was invasive and procedure, and it is still being done because doctors are trained to palpate the lower part of the abdomen. And surgeons are still doing before surgery. I as a radiologist also prescribe or suggest to do a manual test because there are conditions where the indicators are quite the same, and you cannot say for sure. That's why we need new large generation biomarkers. But you are saying now it's more efficient, much quicker, more precise. Yes, most definitely. But we have to look at what's the accessibility of MR. Unfortunately, there are queues, especially if we are talking of state-paid diagnosis. How many men are waiting for too long? It is difficult to say, but there are very many first-time patients of cancer that has been when the cancer has been discovered too late. So human factor, when a person doesn't feel well, when the person is tired. When a person is tired, it is too late. That's why we need to do regular checkups, especially for men for prostate cancer. I have a dream that maybe the fatigue is due to some other reason, and we can take our small device, small tester, and it will actually tell me which specialists I have to visit. What you as a doctor could wish for in your work life in order for the patient, for that young person or not so young man to get diagnosis as quickly as possible. I would want a complete scanner of a person or a mapping of a person where you can see the changes of organs, discrepancies. So we could start with less invasive methods. MR is very, very good, where we can scan a person from head to toe. And if there are significant clinical changes, then we can react. It would be good that MRs could be placed in gas stations where the tests reach my doctor, and the doctor will call me and say, you have to see me because there is a deviation from the norm. I think it will be present one day. This will be happening one day. At that moment, you will not fill in the gas. You will rush to your doctors. But why gas station? I, as a patient, as a person, I will go to sleep, but the bed could tell me what I should do in the morning, whether I have to visit the doctor or not. Maybe I don't have to visit the doctor because everything is going to go on remotely. In the future, patients will be even more and more, as the doctor from the audience said. And all around the world, the number of doctors is decreasing. So we have to come to aid with devices as well as artificial intelligence. We are going to talk about that. How do you describe your generation? First, second, or third? Do you know what is fifth generation? Do we have anyone from the fifth generation? Fifth generation is robots. And no anthropologist is going to deny it. And especially in medicine, there is going to be a lot of robots. I'm not talking about a robot in a warehouse or in a restaurant, but a helper, assistant to a doctor. No, and I'm saying to a doctor, not the robot will take a decision whether to exercise or to do under a knife. The doctor is going to take the decision, but the robot will assist. Can you live with that? Can you live with the fact that your assistant is going to be a robot? Yes, I am impatient for that. At home, I am very impatient of seeing robots next to me. We are talking about aging in Europe. There will be robots who will help socializing for people not to feel alone. I hope that is going to be a solution, also half medical. But I would want to talk about smart devices, such smart devices as smart water closet, which could analyze the content of urine, or smart toothbrush, which could indicate that you have to visit a doctor, a dentist. There will be a lot of data, and artificial intelligence is going to be needed a lot, because this data will be able to be processed only by robots. So we cannot, no human is able to elaborate all those data. We all will have huge amounts of data on us. Also, it would be good that from the first blood test, a boy's PSA amount is being indicated, and at an early stage, one can see the increase in PSA, or you can follow other indicators, or already mentioned fatigue, and that would be very useful. Thank you very much. Yes, indeed. I would rather gladly delegate a lot of things to delegate to a robot. for example, to sign documents, but I would want it to be my choice, which things I will delegate to a robot. For example, content of my fridge, I will not bestow completely on a robot because I like shopping. I like grocery shopping. Kaspers, how much you will allow robot to take over your responsibilities? We use a lot of AI in order to analyze patient data. We sometimes even don't acknowledge it. This is a mechanism, that's a device that helps us. Maybe it is. It doesn't look like a small human being walking around. That is reality, and we are using it already now, all of us. Has someone said to you, AI took a decision, but I'm telling you, you have to do the following? Would you be able to trust something that has been discovered by a robot? There are algorithms that might be faulty. Okay, we have a doctor amongst our audience. Unfortunately, we do not hear. This is an artificial intelligence trying to fight against the possibility to talk. Patients are very clever at the moment. They are building up their own lists of symptoms. They already have suspicions on what they could have because Google has already decided from their indications what's wrong with them, and they come to us for reassurance. And then Google will come up with an algorithm that you have to buy this and that because you have this and that. Many patients are coming with Google indication list. I have a question to the doctor in the audience, Dr. Vilkoite. In how many cases this symptom list is faulty, and in how many cases it's true? I would say 50-50. So in 50% of cases, it has been correct. I work every day with patients, not only with devices. I am a GP. That's why I could say 50-50. This ratio, is it increasing or decreasing? I don't know. So before, some years ago, was it different? In the last 7 years, it's more or less the same, 50-50. Isn't it that people are relying on what they have? For example, their blood pressure, their pulse, their heart rate, you are looking at meters, everything is clear. Although like 5 years ago, it was something unimaginable, but maybe at one point the device could tell you you have to take pills or you have to go under the knife of a surgeon. How much percentage-wise, in ratio, are you ready to rely on your devices, or are you drinking herbal tea with honey, and that's everything is okay? So we have a point of view. Speaking about those devices, I myself am following my heartbeat and intervals, but it is important to understand that it might indicate something. But for me, it is important to have a point of view from a real person, from a doctor. It is or is not, because those devices, which will become even better when developing, but I believe at this moment we are still living in the age or era when we have to visit a doctor who will be able to help us what is needed for me. AI will not be able at the moment to decide it for me. That is the gut feeling that is speaking, isn't it? Probably you cannot explain it. It's something abstract, but is it dividing the situation? In this watch, you cannot see a lot. For example, you can see the discrepancies of your blood pressure or heartbeat, but the presence of cancer you cannot not see in a watch or a device. If you have a lung cancer, most probably you will hear and feel it when it's too late. Don't tell about my medical history. I am engaging into sports a lot. But at one moment, I am looking that I am too slow. I am too slow now. Speed dynamics, it is decreasing. I am tired. I am losing sleep. But in life, I am okay. I'm calling the doctor because I'm about to turn 50. He says, come to my clinic. I am visiting the doctor. The first thing that he does when I showed my blood pressure and heartbeat, he did everything what we talked about with simple tests and also with a palpation of lower abdomen that you talked about. That simple physical test, not blood test or something. Yeah, the doctors can be asked questions. Prepared patient helps doctors. We are talking about data, algorithm, patients themselves. Overall mixture of that, clever mixture of that helps doctors. Also robots that might help doctors to diminish the time of visit. The doctor can economize a lot of time. Will you agree? Yes. Especially if it's electronically, if one doesn't have to read through pages and pages. Because for a visit to GP, the time is limited. Very many people come with a long history of their health. What is that? A summary? Is that a summary? They test results within a year. There you can see specific markers. For example, some indications of increase of certain levels, but then the doctor compares the data manually. I have heard of people people collecting their own health data, but I would like to have an application how my indicators change, whether they have increased or decreased, or maybe I have maybe I could get a digital data with indicators, with arrows up and down. Already now, doctors can compare the data, for example, for pancreas indicators and markers. You can download certain tests, but there is not a curve where we can follow an indicator. But when you enter my health data, my esalības dati, so you can obtain the data for a certain time in a certain situation, but at one point they are placed together in a certain box, and they are being summarized, and this data, when sent to the doctor, can see overall picture, also correlations, indications, nuances, increase, decrease of certain markers. And this is our platform, prepared patient remotely can send this information to the doctor, and then the doctor in a chat, in a video chat, says, you have to visit me or you don't have to visit me. Dr. Vilkaita, when those 50 Google positive, 50% Google negative patients come to your practice, how do you deal with them? How you persuade that person that everything is okay? You have done a lot at home. You have done your homework. But let's evaluate critically your indicators, and I will do it for you. It is not so easy. You have to look at all the indicators. Also, health, if there is a 20-year-old patient, I am not going to talk about and think about some intestine cancer, but if the person is 50 or over, then I might send to certain tests for to eliminate intestine cancer if certain indications are there. Also, family history. I like what you've said. Let's raise your hands. We will be discreet. Raivo is not going to film that. How many of you internally have gone to the doctor? You know what's wrong with you. You have read in the doctors, and the doctor says, no, it's not true. And you think the doctor is stupid. How many of you have already experienced that? I don't know whether Google is an AI, but what data you have, thank you for being honest. You have done that. Yes, you have been in situations where you trust what has been written online or what correlates with your situation and not to the doctor. Yes. How often you encountered those people when people are relying on data that they have obtained from AI or maybe from magazines or data that has been misunderstood? How often do you have to say, no, it's not true? You have to look at the source of information. Google is not the only place where, or not the place where you have to look at scientific literature for the scientific literature. People are not reading studies. Google is very often yellow pages or gossip columns of medicine as well. Where all kinds of under-the-table remedies are being promoted. So that's why it is very important if you are not looking at everything. For example, elevated markers. Those elevated markers could be for a reason. This information has to be combined with family history, other tests. So tests themselves or symptoms themselves, especially when Googled, will not give you a diagnosis. We are overwhelmed with information, and people are interpreting information in different way. People choose sources and choose what to believe in. But what is this? We have to understand also that this true information is in professional language, and it is difficult for an average person to understand that. So maybe that's why we have to explain in a simplified language. For example, source Mayo Clinic webpage, where very precisely, but at the same time, very scientifically, people are being taught, scholared. Yes, maybe I am old, says the moderator, but I believe that medicine as such should be straightforward and in Latvian for a person not to be lost in the woods. So the person will not read only the words that he understands and likes and comes up with the diagnosis for themselves. Please raise your hands, those who are 20-something. Do you, in your daily life, would give your keys from your apartment to a good friend? Yes, yes, yes. Would you give 5 euros to your good friend on a daily basis? Yes. Would you give a bike to your friend? Yes. A stranger approaches you, but you kind of trust that person. You give that person 2 euros, most probably, but what you would never give to a stranger. Would never, ever give to a stranger. You would never give your mobile phone, your mobile device. What I am saying, why I am saying, this is the generation. They will do everything, but they will trust their mobile phone more than their life. This is the story about the future, that your mobile phone should contain everything, including doctor's assistant. Can we use Slido? We would like to get feedback from you. We would like to measure your temperature, not directly but figuratively. Please do write in your mobile devices Slido. Instead of hashtag, do write medicina lampa. Can you find it? If you cannot find it, raise a hand. We will help you. Slido, hashtag, medicina lampa. Very good. People are registering. Those who cannot access this site, do raise your hands. We will help you. Do write your name in it. I encourage you to go to technical universities. They have drinking water. They are distributing drinking water. And now a question very simple. How do you evaluate the development of AI in medicine? So you have this question and 4 replies, 4 options for replies. Good. I like this thought, but it can have bad consequences. I think that it will bring more worse than bad than good. Or I have no opinion. The results, what are the results? The majority, big majority says it is good. We need smart technologies. This is what we are saying. Yes, some people said that they can do without AI. They have a good GP, good person, a good doctor. Sometimes yes, sometimes no. Gundar, can you just tell us, a ready patient which has already done his homework, has a lot of data, is it good? It's good. And what is your vision about technologies, existing technologies in the market, not the ones that we are dreaming for in 10 years, but what is there already now? At the moment is something that we have discussed already about. When submitting blood for test, The patient can not only receive information on PDF, also one can see dynamics. Also, one can compare. There are curves and algorithms and arrows for patients' information. If the indicator exceeds or is not enough over the norm, the indicator or an alarm is there, and the patient understands what it means, what is wrong, and what is the solution. Which doctor to see. The algorithm can already add information on which specialist to see. This is already today. This is there. This is now. What all the IT specialists are now trying to do, all the data that were stored in servers as data, as archive data. But as you know, a doctor cannot go through your data for a long, because it takes a long time. But now AI or algorithms can go through your data and give the doctor only the essence, only the content, only the pulp for him or her to take a decision in a short period of time based on your tests and your history. Whether this system, those data conflict, medical system as such, no, it is not. So this system goes hand in hand with overall medical system. Yes, this data is being processed, it is being incorporated and is in process. What is there to become of 2022? COVID. COVID even increased what we have. Namely, we are doing things remotely. Also, we can visit. Doctors' appointments can be done remotely. Have you been to the doctors remotely? Yes, there are. There have been people to the doctors remotely. So it have already resulted in a precedent. As already someone mentioned, the number of patients and also the number of decreasing number of doctors, as well as our pace of life dictates the necessity for remote doctors' appointments. If there is no specific need to come and see face to face, then we can do everything remotely. Or if we had face-to-face visit, maybe we don't have to repeat the visit and to receive the information and what to do afterwards. We can discuss. Follow-up visit can be done remotely. So we will soon become holograms, doctor in his practice and we at home. But maybe you have already a vision, starting with tests that can be performed by a difficult or technically challenging device, and even quicker forecast what is there to become. Already now, those devices that we already have at home, devices, if I may call them so, they are old. We have the thermometer, all of us at home. Maybe how many of you do have a measurer of blood pressure? Many of you. Oximeters. Anyone having oximeters? Yes, many. Oxygen meters. Those devices you already have at home. Who of you has a smart blood pressure measurer already sending the data to application? One person has it. Okay. At the moment, those devices are maybe very expensive and inaccessible. In the future, they will be more accessible, cheaper, although at the moment they are not communicating with program. We can manually input information in programs, and algorithms can read the information. Because for example, what can you do when your temperature is elevated? Communication platform where which is helping doctors, for example, to monitor COVID-19 patients. It's a pilot project, but how we can make the life of doctors better. Namely, the doctor gives a plan, what should be done for a patient at home, and the patient is doing that. And if the indicators are becoming critical from oximeter or from thermometer or from blood pressure measure, then the doctor is being warned, and you can live peacefully, and the doctor can be at ease because he or she knows the indicators will be the alarmful indicators are going to be communicated, and in critical situations, the indicator will also say you have to call 911. Another question: are we responsible towards ourselves and also towards doctors? Because I have a hypothesis that technologies will give even more room for avoiding doctors and avoiding or looking away from one's own indicators, symptoms. We have to understand the significance of our symptoms. With devices, we will never be able to find out deviations of our organs from the norm. But we do have different devices used by GPs, and they can, for example, make an image of one or another organ and send to a specialist. And those devices will become even more and more accessible. Our GP practices will be equipped with them, or we will even be able to do it at home. We can scan, for example, our brain at home using a helmet. Okay, very good. Very good. Using a helmet, but maybe I will have a roll-type device and I will be able to diagnose myself, for example, a pancreas deviation or something else. And I will send, dear doctor, I will send you the information. The doctor is in one place, the robot is in another place, and I am at home diagnosing myself a blind gut, for example. I hope that the internet connection is going to be stable, but what we have to think, we have to educate ourselves in technologies. Also, we have to follow our health, and we have to start early, when we are 16, 17, 20, and more. There was a survey in England, and in 70s, the data from people who were born in 70s something, and now they are 50, and they stated that they found out that 30% of them have some problems: diabetes, back problems, alcoholism. 48 years of age is already too late. Those patients should have been monitored much earlier, and that could be achieved with the help of technologies. With those smart devices, we could follow our own health and notice deviations from the norm much earlier, thus not allowing for incurable chronic diseases to take over. I would like to add, those are two important topics. The health skills, being smart about one's health, understanding why we need walking, why we need drinking water, and why we need to drink less sugar-containing substances. Those are all health skills, and those should probably be the initial skills should probably be taught at school. The earlier we will understand and why we need it, we will be more responsible. The doctor can do a lot, but if we will not follow the instructions, the results will not be achieved. This is respect for one's health, also towards the family and towards the society at large. Early diagnostics. Let's talk about it philosophically. If you knew, like 5 years ago, what is expecting you, for example, the helmet, that you can scan your own head, maybe wouldn't it be playing God? Already now, when doing our the diagnostics, we see what this person is expecting. For example, spinal changes, maybe genetically or due to incorrect posture, and at an early age, these deviations can be observed, and they might progress later. Or, for example, we can see that due to some lung problems, the stents will be needed at a later age, or that muscles are less than necessary. We can already predict that in future years, in older years, a hip bone most probably will be fractured, and that person will be crippled. So that's why you have to take in additional calcium, potassium, and make the structure of your bones much stronger. You mentioned examples that are self-evident. Our backbones will be crippled, and old people will break their hips. But I am more telling about sensitive issues. For example, malignant cancers. The person is being told directly that you, not only that you most probably will be diagnosed by cancer, but that you will be diagnosed by cancer. Yes, that is true. That's why genetical tests are being performed, and for example, breast cancers or ovary cancers, and surgeries are being performed also, preventively, and this is the area which is going to develop, and together with early diagnostics, together with remote diagnostics, this is going to be our future. Genetics. 20 years ago, when a human genome was sequenated, then everything started. When genome was sequenated, we had a feeling that everything that we will be able to do, we will sequenate our genomes, and we will be able to say what diseases we will have at what age. Now we understand that it's not entirely true. And when you understand that genetic variations and factors are just one thing, and only a small portion of diseases can be explained. So yes, you mentioned breast cancer and ovary cancer. If your genome, when sequenated, contains the markers, then most probably you will have or you are inclined towards that. But very many things cannot be explained by genetic factors. And there it is understandable that everything coincides and corresponds, namely your genetics with your lifestyle, with your perception, etc. And we are very, very clever, not only with our lifestyle, but only with other things that we can do or not do. We can make our lives longer. Yes, there is a science called epigenesis, genetics, which talks about our lifestyle and its impact on our genetics. For example, unhealthy lifestyle will foster one or certain type of disease. We have now a project for 1 million gene sequenation. Estonia is very actively working on those genetic genome data. They have selected people with genetic parameters that might be contraindicative to certain drugs. And I think this information is very, very good. And when these data will be collected from 1 million people, we will be able to take out and study the data, and we will be most probably correlated to test data, to other information collected by specialists, health specialists. So last 10 minutes we are talking about an issue we asked at the very beginning, Kaspars. Also for cancer, you do genetic testing, and the therapy or treatment is according to genetic tests. And the successful treatment is already there. For example, if previously late diagnosis in certain cancers led to life expectancy of half a year, then now with certain things being applied, the person can live for 3 or 4 or 5 years. So let's wait for the train to pass. There is a background noise. So we can think our lives over, what to do and what not to do. I am sorry about this silence. It's a long one, long train. Are you counting carriages? It's beyond our control. In Tsarsu Gymnasium, I was counting carriages when I was studying. So sorry, what were you saying about cancer genetics? If we are talking about that and about forecast for the future to come up with diagnosis, you will take your blood test on the cell, you will place in a receiver, and it will tell you today your genome has certain deviances. In 4 years, it might result in this or that, and today you will have to do the following to eliminate the risk. I think you will not need any blood pressure. You will have a chip most probably implanted into you, and it will send a signal to you. I don't like it. How many of you have studied or is studying medicine? How many of you are doctors already? Can you answer the following question? How you young people do see the future. Diagnostics in 10 years, when you will be still practicing and when you, the young ones, will start practicing. Do come up with a vision, because we on the stage can talk about big data and studies, etc. But how do you see it, your future work? Someone has to write a bachelor or master's paper on that. Can we agree on the following? We have looked at the many things, starting with genetics and big data and attitude of patients. Do formulate your answer, which I asked at the beginning. How do you see the future of medicine in 10 years? I will start. I've started with the following, that I will have a computer where I will see information topical for me, my age, where I will see whom I have to see and when. I will be an informed patient. I will virtually connect with my doctor. He will reconfirm it is needed or not. I will have smart gadgets, tested gadgets, certified, verified gadgets. I will follow my health and live happily ever after. Me too. I also stick to what I've said previously, namely those chronic diseases that we know we have. We will be able to live with them better using mobile applications, which will allow us to monitor the progress, the status quo of our disease. We will be much more educated on those particular diseases, but first-time diagnosis will still be held, will be placed at the GPs, at the doctors. What do you think? Diagnostics will develop and devices will be more accessible. MR and other devices where we have long queues to wait on, they will be more accessible. Maybe new rays will be invented in the future, rays that we do not know now, but rays that most probably are there. When Röntgen invented or not came up with the rays, or MR was first discovered, and this new ray will be very informative, and we will be able to obtain all that information. Very good, actually, very good. I can imagine. Gundars, what do you see the future in 10 years? I would say remotely. We will do everything remotely. This will be the decisive or the main trend in 10 years. I can fantasize about gadgets, but the primary and the only one will be the following. We, the biggest part of society, will use it, will do everything remotely. But I don't think that doctors, even not in 10 years, but in 40 years, will be substituted by robots. What you said, that robots will take over, no. Doctors will be there, but they will be assisted by robots. But most of our lives and doctors' appointments will be remotely. And the last question, and I will leave you alone. Would you want at this moment to learn what disease you will have in 10 years? You're shaking your hands. No, you don't want to know what you would like to fall ill with in 10 years. Teenagers said, yes, I want to know. Very good. That is intimate question, and sorry for that. I visited a doctor once, and he said, never forget to talk about and remember about death. Memento moris. Thank you, and applause to Gunārs Razevskis, Tūna Riekstiņa, Aija, Līne, and Kaspars. Best of luck to those who study medicine, and let's not tell to the doctors, see you later, but let's say each other, see you later, and enjoy. Goodbye.